Hi, everybody. Today we are going to talk about the digestive system. So let's go ahead and get started. So the first thing I want to talk about is the two main functions of the digestive system. So those two functions are digestion and absorption. So first thing that I want you to understand is when we talk about digestion, there are two levels of digestion. The first one is what we identify as mechanical digestion, and the second one is chemical digestion. So the word digestion itself is basically means breakdown of the larger food particles to smaller pieces. Now, mechanical digestion is basically using some sort of force to digest or break your food. That could happen in your mouth as you chew your food. It could happen in your stomach as the food is moving through the, the stomach, and the churning action of the stomach will move the food and break it down to smaller pieces. If you're talking about chemical digestion, however, the main part that is breaking down your food to the smallest subunit possible is a requirement for the digestive enzymes. So if you guys remember from early on, enzymes are basically what we identify as catalysts. These are the things that speed up the chemical reaction. So in this case, the chemical reaction they're speeding up is breaking down your food molecule to a smaller components or subunits. Now, again, recalling from our earliest lecture in the semester, when we looked at the organic groups or macromolecules, we have three main groups that basically is the typical food you consume, which were carbohydrates, fats, and proteins. So when you are carrying the process of chemical digestion, what happens is the carbohydrates are broken down to simple sugar. Example of that would be like your glucose. Fats, which are basically also known as lipids, get broken down to glycerol and fatty acids. And if you consume any sort of proteins, their final breakdown would be amino acids. So basically, you took these things, you break it down mechanically and chemically, and they are still in the digestive tract. They haven't been transferred into the bloodstream. So the second part of the, or second function of the digestive system is a process known as absorption. Absorption is moving these nutrients, which is simple sugar, glycerol, fatty acid, and amino acids, from the digestive system into your blood. Please do note that not everything that our body brings in will be beneficial to us. Some of these are harmful and are required our body to detox the blood before we move on and circulate that blood into the rest of the body. Now, this picture is really important. I do want you guys to pay specific attention to the identification of the components. So I do ask questions for you to either identify the components or write the path of the food through the digestive system on your own. So please make sure you guys are comfortable with this. So first of all, before I start, understand that when we talk about digestive system, you have the path of food, which is basically what I've described here, and you also have what we identify as accessory glands. And these accessory glands, I'm just going to label them for you, would be your liver, your gallbladder, your pancreas, salivary gland, and you also have your tongue. It's not depicted here, but also your teeth will all identify as accessory glands. These are structures, basically, I apologize. These are structures or organs where the food doesn't pass through them. However, they do contribute to the digestion and absorption of the nutrients. So what is the path of food? So I'm going to use a different color. I'm just going to kind of number them for you as we go through them. So it become a little bit easier, hopefully, to follow for you. So we start with our mouth, which is oral cavity. As we pass through the mouth, you go to the pharynx. So pharynx is the next structure. Do note that pharynx has two parts in this case for the digestive system. One is the oropharynx, which is right behind your mouth, and then going down, connecting to your larynx, is your laryngopharynx. The long tube that is going down your throat is called the esophagus. From the esophagus, you work your way to your stomach. So stomach is number 4. And then from a stomach, you move into your small intestine. Now, small intestine has 3 parts. The part that is immediately connected to your stomach is the duodenum. The top parts in the middle is your jejunum, and the bottom parts of the, or bottom folds of the small intestine is the ileum. A small intestine passes the food to the large intestine, which starts with this sac right here called the ceca. Food then moves up as an ascending colon. Food goes then across as a transverse colon. Food comes down through the descending colon, twists to the back through the sigmoid colon, and then eventually goes through the rectum, anal canal, and out of the body, which is basically the anus. So again, know the path of the food, and I will, if I ask you guys to label the parts, the answer going from a small intestine to large intestine is not sufficient. You are required to label each component. Now, when we're looking at the digestive system or the wall of the digestive system, you can find 4 layers that forms the wall of the alimentary canal or your gastrointestinal tract. And this is basically, it starts with the innermost lining, which is called the mucosa. So this is your first layer. Mucosa, as the name implies, is basically going to have a lot of mucus, and the main goal is lubrication. Second layer we have is submucosa. This is going to contain blood vessels and nerves. So this is the layer that does a lot of the absorption. So again, absorption was bringing nutrients from the digestive tract into your bloodstream. So that's where your absorption will enter the blood. Muscularis, as the name implies, or muscularis externa, is made up of a smooth muscle. And this is basically have 2 goals. One, to help with the mechanical digestion of the food and kind of mix up the food with the digestive enzymes. And then also the fact that you want to basically move along the food through the digestive tract. So you don't want it to be stuck in one position. So you want to allow it to keep moving forward. And that's known as peristalsis, but I don't need you guys to know that word for now. Now, the outermost lining of the digestive tract is what we identify as serosa. It is made up of 2 layers. It's a thin layer of epithelium and also a thin layer of connective tissue. Sometimes epithelium is missing and it's only connective tissue, but sometimes it is both present. Now, also do note that the central opening where basically food passes through, that cavity is known as the lumen. Here is basically what I've just talked to you guys about: mucosa, submucosa, muscularis, and serosa. Please do note that what we identified as IBS, a lot of people might have heard of it. IBS is basically irritable bowel syndrome, which is irregular contraction of these smooth muscles we talked about. It can cause different symptoms, including a stomachache, constipation, or diarrhea. Now, looking at the path of food through our digestive system, we started with our mouth and oral cavity. So the roof of your mouth is actually have 2 breakdown, what we identify as hard palate and what we identify as soft palate. Hard palate is the more anterior aspect of your throat. Basically, you have a bone underneath it called the palatine bone. So there's a bone underneath it called the palatine bone. As you go farther, the second part basically is missing the bone, so the tissue is soft, and this is again no bone. and that's called the soft palate. At the end of the soft palate, you have this little hanging structure, which is called the uvula. Uvula basically makes sure that the food doesn't move up to the nose or nasal cavity, and it only can go downward. So it doesn't want to, we don't want the food to go up toward the nose. You want it to always move downward. So it does move to make sure the food cannot backtrack to the nasal cavity. Now, one of the most important aspects of your mouth is the presence of what we identify as salivary glands within the oral cavity and releasing of the saliva. So, salivary glands, actually there are 3 of them. What we have here is referred to as the parotid gland. The one that's underneath your tongue, this one is called sub, as an underneath, lingual, as an underneath your tongue, and this one that is built into the mandible called the submandibular gland. Now, each of these salivary glands produce different type of saliva. It could be super watery, like what you release from the parotid gland, or it could be super thick, what it gets released from the sublingual gland, more mucus-like. Now, one of the main components your salivary glands release is saliva, which just kind of makes sense. What is inside the saliva? Saliva includes, I don't know if I have this. Saliva includes, and I'm just going to write this, includes water, which is kind of logical. It includes ions. It includes antimicrobial components. It contains an enzyme, which is what I want to focus on, and this enzyme is called amylase. Now, again, remember, this enzyme is a digestive enzyme. This digestive enzyme only works on a specific group of foods we call carbohydrates. So when you take a chunky carbohydrate and you introduce your amylase, which is your enzyme, amylase breaks down the carbohydrates to simple units of sugar. Again, you take that chunky structure and you break it down to individual subunits. So, and I put that in quote unquote, not necessarily that's the goal, my goal of tricking you, but I want you guys to understand, when you're using your mouth and you chew your food, which is a mechanical digestion, you're putting force on your food, you do not distinguish one food group from another. So mechanical digestion of all food groups starts in the mouth. So let's make a notation for this. So mechanical digestion of all food groups starts in your mouth. Again, think about it logically. You don't push a piece of meat and say, oh, you're protein, I'm not gonna chew it. Oh, you're a carb, come over here, I'm gonna chew it, right? You're gonna chew all the food that you eat basically regardless. But when it comes to chemical, for chemical, as soon as you hear chemical, think about what? Do you have the corresponding enzyme? Do I have the enzyme for protein breakdown? Is the answer yes or no? No. So no protein breakdown. Do I have enzyme that helps me break down lipids? The answer is no. Do I have an enzyme that breaks down the carbs? The answer is yes, and that enzyme is amylase. Now, a couple other notes. You have heard of the vaccination called MMR. MMR is a vaccine for 3 conditions: measles, mumps, and rubella. So mumps, which is the middle one, the second MMR, I guess I should say, it's basically where your salivary gland, most specifically the parotid gland, is getting infection or getting infected, and as a result, it swells up significantly, causing significant amount of pain when you basically start to release saliva, which is all the time. So vaccinating against MMR helps you not to deal with that condition, or mumps. When you do have mumps, you also can notice the sides of the face swell up significantly. If you ever seen people have pulled their wisdom teeth, you notice that they have the similar swelling on the side of their face, right next to their ears. Within the oral cavity and pharynx, you also have the tonsils, which are again surrounding your throat. And the goal of those is to protect against any bacteria that either enter through mouth or your nose. So pharynx has both job, mouth and nose. Now, another accessory structure we have in our mouth is our teeth. So first of all, there are two sets of teeth when you are born, or when a baby basically starts to teeth. You're only going to have about 20 teeth. These are identified as deciduous teeth. So in this case, basically these teeth right here would be identified as deciduous. As the child starts to grow, they start to lose their deciduous teeth and replace them with permanent teeth, which goes up to 32. This picture kind of depicts the other teeth that are on the gum line coming in, and again, pushing the deciduous teeth out and gets replaced. The main reason for having less deciduous teeth compared to permanent teeth is because in children, the gum line does not support that many teeth, or your jawbone doesn't support that many teeth. But as the gum line and jaw grow in size, then you can fit more teeth into the mouth. Now, when you look at your teeth, you have external and internal structures. The external structure of the teeth is basically you're looking at a tooth. You have the crown portion, is the part that is sticking out. You actually have this region, which is not labeled, and sometimes I don't talk about it. The part that connects the crown to the root. This is considered the neck of your teeth. Again, a lot of times I don't discuss it, but it's good to know that the external structure is actually in reality 3 parts. Now, internal structure of your tooth is if I make a longitudinal cut through a teeth, what I would see inside my tooth. So the first thing I would see is the outermost part of the tooth, which is this. This is the part that is also visible. This is called the enamel. Enamel is a hardened material that protects the underlying tissue called the dentin, which is this layer right here. Dentin is very similar to bone, guys. So in terms of material, it is made up of significant amount of calcium and phosphate that makes it hard. It also gives you the teeth its shape. Within the dentin, you have the third layer, which is called the pulp cavity or pulp. What do you have inside of it? You have your nerves and your blood vessels. So when you think about your teeth and the pain associated with your teeth, you can see as the damage grows inside the teeth because of the cavity, the pain will become more severe and severe because you get closer and closer to your pulp. So what is exactly a dental cavity or tooth decay? So when you eat food, well, before actually I start talking about that, first thing that you want to understand is regardless of how perfectly you brush, you're always going to have bacteria inside your mouth. Now, the more you brush and the cleaner your mouth is, the less of these bacteria, and basically the less you take care of your teeth, the more bacteria you have on the surface. Now, as you eat, these food are going to form a lining on the surface of your teeth. It's called a biofilm. And now you have bacteria and you have food. Now, it doesn't have to be sweets, but sweets are a lot easier for the bacteria to process. So what happens is your bacteria is going to eat the food that is stuck to the surface of your teeth. And as a byproduct, your bacteria is going to produce acid. Now, acid are harmful to your teeth. So if you take a healthy teeth and add acid, which is produced by the bacteria, that slowly causes demineralization of your teeth, and basically it eats through and erodes your enamel and eventually your dentin if you don't fix it. And that's basically a cavity. Basic measurements for preventing dental cavities is limiting sweet intake, again, because that's the easiest way for the bacteria to gain access to food, and daily brushing and flossing. So again, anytime you talk about taking care of your teeth, the two keywords is brushing and flossing to make sure you get rid of it, and then again, limiting your sweet intake. Now, what happens to a tooth? Again, if you have what we identify as cavity, is you start by destroying and going through the enamel. If you don't fix it, so if you don't fix your cavity, the damage continues to go down through the dentin. And if that is not fixed, then the damage goes all the way to your pulp cavity. This is where it becomes super painful and usually end up with a root canal, where they have to basically cut through the crown and dentin, go into your pulp cavity, remove the nerves, clean it up, add antibacterial and antimicrobial antibiotics into your teeth, cover it up, and then put a fake crown on your teeth. Now, other than the pain, it's also costly. So if you do have a cavity, take care of it. So if you take care of it preferably when it's at the enamel level, so the rest of your teeth is protected. So again, root canal is a procedure that replaces the infected pulp in the root canal with inert material. Another thing that you see in terms of dental problems is what we identify as gingivitis. So gingivitis is simply put is inflammation of the gum line, which is basically as the bacteria starts to grow inside the mouth, that triggers the inflammatory response in your body, and that causes the swelling and the redness around the gum line. Now, as we go through, again, through the passage of food through the digestive system, the next structure after the oral cavity is your pharynx. Again, please do note that the pharynx has two parts. So in this case, if it's right after or associated with your oral cavity, which is right here, it's called oral pharynx. And if it's associated with your vocal cords right here, it's called laryngopharynx. It is something we discussed in the respiratory system, so please review that back. If you still have any questions, keep it, and I'll talk about this during our office hours. Now, food then continues to go down this long muscular tube called the esophagus. Quick note, the esophagus is actually made up of both a skeletal and the smooth muscle, which basically means up to certain points, which is more superior aspect of the esophagus, you can choose to swallow your food. But as you go farther down, getting closer to stomach, that process becomes involuntary, and the smooth muscle movement itself pushes the food downward, and you really don't have any control over that. Next structure after the esophagus is the J-shaped organ we have right here, which is your stomach. The stomach passes and falls right below the diaphragm. So this dome-shaped muscle we have right here, that's your diaphragm. Now, a couple of notations for the stomach. So showing this picture, I'm just gonna change my color. Sorry guys, give me 1 second. With magenta. So you have circular muscles that are found at the beginning of the stomach and at the end of the stomach. This muscle, this narrowing or the circular muscle that is located right here, is actually called either lower esophageal sphincter, or we also can call that the cardiac sphincter. It is called a cardiac because if you can imagine, your heart would be sitting right here. So this dash line I'm drawing, that's your heart. So it's the region right below the heart, so I can call that the cardiac region. This ending where your stomach connects to the first part of the small intestine, so this is duodenum, is the first part of SI or small intestine. This is another sphincter called the pyloric sphincter, which controls how much food moves, how much chyme, I should say, moves from the stomach into the small intestine. Now, again, before we move on, couple of notation in terms of your stomach. So a stomach has multiple regions. This region right below the cardiac sphincter or associated cardiac sphincter called the cardiac region. This dome-shaped part of your stomach, that's called the fundus. This midsection here is called the body. And then this funnel ending to the stomach, that kind of narrowing on convergence, this is called the pylorus or pyloric region. So the name pyloric sphincter comes from the association with the pyloric region, and the name cardiac region and the cardiac sphincter associated with this closeness to the heart. Another thing that you need to notice about the stomach is you have these patterns or folds inside the stomach. So these things that you see right here. These patterns are called rugae. These are folds in the stomach that allows your stomach to increase its capacity as you eat more and more food. So what does that mean? When your stomach is empty, in average, a stomach has at empty had a volume of about ½ liter, and all of the folds or rugaes are basically folded together, making the stomach is relatively small. Now, as you start to consume more and more food, these folds or rugaes starts to expand and basically or open up, allowing the stomach to increase the size 8 times its normal size or empty size, up to 4 liters. So if a stomach is empty, it's about ½ liter, but it can go all the way up to 4 liters when the person consumes more and more food. Next thing, when you consume food inside your stomach, and I think I have to go back to here, inside your stomach, you are going to do multiple things. First, you're going to start to do the mechanical digestion or breakdown of your food. Again, mechanical digestion implies that there is some sort of force or movement that creates this. In this case, the movement is called like the churning motion of the stomach. It's associated with the smooth muscle. So churning is created by smooth muscles. There are actually 3 separate layers of a smooth muscle that are rubbing against each other, creating the churning motion. It's literally like a washing machine that helps your food break down to little pieces. Second thing that happens, again, here's the keyword, guys, chemical digestion. As soon as you hear the word chemical, you have to think about an enzyme. In this case, the enzyme is going to help break down protein, and the name of the enzyme is pepsin. So if I'm looking at chemical digestion, okay? If I say chemical digestion of carbs in the stomach, the answer is no. Do I digest lipids in terms of enzyme inside my stomach? The answer is no. Do I digest proteins in my stomach? Again, chemical digestion. The answer is yes. How do I do that? I use an enzyme called pepsin. Now, environment of the stomach is also very acidic. The reason it's acidic is because you have a specific acid called hydrochloric acid. or HCl. It has two main functions. One is to kill majority of the bacteria as they enter the stomach. The second is to activate your enzyme, enzyme pepsin. So if you don't have the acidic environment of a stomach, first, you cannot digest proteins because there's no pepsin. And you also can't kill most of the bacteria. Your stomach also stores food until it's ready to send that food to the small intestine. And lastly, you have minor absorption. It's not this major absorption, minor absorption for alcohol, water, and some medication like aspirin. So kind of let's take a look at this. Alcohol. So notice a lot of times they say if you go to a bar or if you're drinking, they usually suggest for you to eat nuts or pretzels or bread or something with your alcohol. That basically absorb a lot of the alcohol into itself and prevents that alcohol to be directly absorbed into the stomach. So it basically slows down how much alcohol being absorbed by your body inside your stomach. Some water gets absorbed. So again, kind of think about it. If you drink water, your thirst response goes away pretty rapidly because that water automatically or relatively in a speedy manner gets absorbed into your system. And some medication, again, they tell you guys to eat it with food because it helps lower the absorption of the material inside the stomach. So before I move on, another point I need to make. We said the acidic environment of the stomach is going to kill a lot of the bacteria that is part of your food. However, sometimes your acidic environment fails to kill a bacteria, or that bacteria is resistant to HCl, and therefore it can grow still even though the environment is acidic. That infective agent can cause problem with the stomach and it creates symptoms like abdominal pain, diarrhea, nausea, or vomiting, and that's what we know as food poisoning. This bacteria, typical bacteria that can cause food poisoning in us are strains of E. coli and Salmonella. Another thing I want to mention is the fact that when the food is done processing inside the stomach, it doesn't resemble anything that you ate. As it enters the duodenum, we won't use the word food anymore. We're going to refer to it as the chyme, again, because it is already partially digested, both mechanically and chemically. Therefore, it is not considered food anymore. One last thing I want to talk about is in terms of acid reflux, or what we identify as heartburn. So we learned that there is an sphincter located between the stomach and the esophagus, and that's known as the lower esophageal sphincter or cardiac sphincter. This sphincter is basically prevent the acidic environment of the stomach to reach the esophagus. However, if for some reason this sphincter is open, food and the acidic environment can move up to the esophagus and cause the damage to the esophagus. Now, please do note that the stomach is equipped to handle the acidic environment of itself. It has a very thick mucus lining that protects it. However, the esophagus is not equipped to handle acidity, and therefore, as this acidic environment gets introduced, a lot of the lining of the esophagus gets damaged, and this is where the actual pain comes from. A lot of times they say that if you have continuous acid reflux, it is really important for you to address it. So go see a doctor because If you don't, these continuous damage to the esophageal lining can cause abnormality in the esophagus cells, and these abnormalities can eventually develop to cancerous cells, which again basically become cancer. So if you do have acid reflux on daily basis or a continuous acid reflux, make sure you talk to your healthcare provider, to see a solution and find the underlying issue that causes the problem in the first place. A few preventative measures includes avoiding heavy meals. So again, the heavier the meal is, the higher the chance of, or the higher levels of acid your stomach will have. And it's also easier to push against the lower esophageal sphincter, and causing that to open up. Don't sleep after heavy meal, or don't exercise. Either of those scenarios can put extra pressure on the esophageal sphincter and causing the introducing the acidic environment to the esophagus. Another thing that I talk to my students is women that are pregnant also typically deal with an acid reflux that could be pretty severe. Their main reasons basically, as a fetus is growing inside the uterus, it pushes the stomach upward, making it easier for the acid to be pushed into the esophagus. If you have high levels of estrogen, estrogen also relaxes the lower esophageal sphincter, making it more susceptible to acid reflux. Typically after childbirth, the acid reflux does go away. Vomiting is another thing. This is a strong contraction of both the abdominal muscles as well as the diaphragm, which allows the content of the stomach to move up through the esophagus and pharynx and oral cavity out of the body. Please do note that people who are bulimic, they will have really, really bad teeth, because again, remember, any acidic environment can cause damage to the teeth. So if the person's continuously throwing up over and over, as that acidic environment hits the back of the teeth, it causes erosion of the teeth. So it's another way of diagnosing people with bulimia. Okay, I'm going to stop here and then we'll continue the next PowerPoint, the next part of the digestive system afterward.